If you take amlodipine, Losartan, or Lisinopril for high blood pressure, I want you to stay with me for the next few minutes, because one of these medications may be affecting your body in ways that have never been fully explained to you. Millions of older adults take these medications every single day. They lower blood pressure, protect the heart, and help reduce the risk of stroke. But they can also cause changes that many people mistake for just getting older. Swollen ankles, a dry cough that won't go away, feeling dizzy when standing up, even muscle weakness or an irregular heartbeat in some situations. The problem isn't that these medications are unsafe. The problem is that many seniors never receive enough information to recognize what's normal, what's manageable, and what should never be ignored. I remember one of my patients, Mr. Robert, a 73-year-old retired engineer. He had been taking amlodipine exactly as prescribed for nearly a year. One evening, he noticed his shoes felt unusually tight. A few weeks later, his ankles had become so swollen that he stopped taking evening walks with his wife. Instead of calling his doctor, he quietly started skipping his medication whenever he planned to leave the house. He was convinced something was seriously wrong with his heart. When he finally came into my office, he looked at me and asked, "Doctor, is my heart failing?" The answer surprised him. His heart wasn't failing at all. The swelling was a well-known side effect of the medication he had been taking for months. More importantly, it could have been managed much earlier if someone had simply explained why it happens. Unfortunately, Robert's story isn't unusual. After more than 3 decades of caring for patients with high blood pressure, I've learned that many of the biggest problems don't come from the medication itself. They come from misunderstanding how that medication works. I'm Dr. Nathan Ashford, and in today's video, I'm going to share 9 important things every senior should know before taking amlodipine, Losartan, or Lisinopril long-term. Some of these points may help you understand symptoms you've been living with for months. Others could help you avoid complications that are entirely preventable. Before we begin, I'd like to ask you a simple question. How old are you today, and which of these medications are you currently taking? Leave your answer in the comments below. Your experience may help someone else who's going through exactly the same thing without realizing it. Now, let's start with something that surprises almost everyone I meet. Although these 3 medications are all prescribed to lower blood pressure, they do not work the same way, and understanding that difference is the key to understanding everything that follows. Things #1. These 3 medications lower blood pressure, but they do it very differently. The first thing every senior needs to understand is this. Amlodipine, Losartan, and Lisinopril all lower blood pressure, but they are not interchangeable. Many people assume that if 2 medications treat the same condition, they must work the same way. That's simply not true. Each one works through a completely different system inside your body, and because they work differently, they also come with different benefits, different side effects, and different warning signs. Let's start with amlodipine. Amlodipine belongs to a group of medications called calcium channel blockers. Think of the arteries in your body as flexible garden hoses. Over time, aging and high blood pressure make those hoses tighter and less flexible. Amlodipine helps those blood vessels relax. When your arteries relax, blood can flow more easily, which lowers the pressure pushing against the walls of your blood vessels. That's one reason amlodipine is often prescribed for older adults. It can be very effective and usually works throughout the entire day with just 1 dose. Now let's look at Lisinopril. Lisinopril belongs to a different family called ACE inhibitors. Instead of relaxing blood vessels directly, it blocks the production of a hormone called angiotensin II, one of the body's strongest natural chemicals for tightening blood vessels. When there's less of this hormone, your blood vessels stay more open, your blood pressure falls, and your heart doesn't have to work as hard. For many people, especially those with diabetes or early kidney disease, This medication may also help protect kidney function over time. Finally, there's Losartan. Losartan works on the same hormone system as Lisinopril, but in a different way. Instead of preventing the hormone from being made, Losartan allows it to be produced, but blocks it from attaching to its target. Imagine someone knocking on your front door. Lisinopril prevents that person from ever leaving home. Losartan lets them travel all the way to your house, but when they arrive, the door is locked, so they can't get inside. Both medications lower blood pressure, but they take different paths to get there. One important difference is that Lisinopril is much more likely to cause a persistent dry cough, while Losartan rarely does. That's one of the most common reasons doctors switch patients from one medication to the other. Here's what I want you to remember. None of these medications is better than the others for everyone. The best choice depends on your overall health, your kidneys, your heart, other medical conditions, and how your own body responds. That's why you should never compare your prescription to someone else's. The medication that works perfectly for your neighbor may not be the safest or most effective option for you. And now that you understand the basic differences between these three medications, let's talk about the side effect that causes more unnecessary fear than almost any other. If you're taking amlodipine and your ankles seem to get bigger as the day goes on, don't panic just yet, because what you're about to learn surprises almost every patient I meet. Things #2, why amlodipine can cause swollen ankles, and why it doesn't always mean heart failure. Let's move to the second thing every senior taking amlodipine should understand. If you've ever noticed that your shoes fit comfortably in the morning, but feel much tighter by the evening, you're not alone. In fact, ankle swelling is one of the most common reasons people become worried after starting amlodipine. And here's what often happens. Someone notices swelling around their ankles or feet. They immediately think, is my heart getting weaker? Others become convinced their kidneys are failing. Some quietly stop taking their medication because they believe the medicine is doing more harm than good. But in many cases, none of those assumptions are true. To understand why this happens, picture your circulation as a highway. Your arteries carry blood away from the heart, while your veins bring it back. Amlodipine relaxes the small arteries extremely well, allowing more blood to flow into the tiny blood vessels of your legs. However, the veins don't relax to the same degree. That creates a small imbalance. More fluid enters the tissues than returns to the heart, allowing a little extra fluid to collect around the ankles and feet, especially after you've been standing or sitting for several hours. That's why many people notice the swelling gets worse later in the day, and often improves after sleeping with their legs elevated overnight. By itself, this type of swelling doesn't automatically mean your heart is failing. However, that doesn't mean it should be ignored either. If the swelling becomes severe, painful, affects only one leg, or is accompanied by chest pain, shortness of breath, or sudden weight gain, you should contact your healthcare provider immediately. Those symptoms may point to a different medical problem that needs prompt evaluation. But if the swelling is mild and began after starting amlodipine, don't make the mistake that many patients do. Never stop the medication on your own. Your doctor may simply adjust the dose, recommend lifestyle changes, or switch you to a different medication if needed. I've seen many patients struggle unnecessarily because they were afraid to mention such a common side effect. Remember, your doctor isn't expecting you to tolerate uncomfortable symptoms in silence. The sooner you speak up, the easier they usually are to manage. And while ankle swelling is common with amlodipine, the next medication has a completely different issue, one that often appears months after treatment begins. It's a dry cough that many seniors spend months blaming on allergies, a cold, or even the weather, when the real cause is sitting in their pill organizer every single morning. Thing #3. The dry cough many seniors never connect to Lisinopril. Now let's talk about Lisinopril. Because it has one side effect that surprises thousands of people every year. Not because it's rare, but because it often doesn't appear right away. One of the most common questions I hear is, "Doctor, why won't this cough go away?" Many people assume they've caught a lingering cold, developed seasonal allergies, or have acid reflux. Some buy cough syrup after cough syrup. Others change their diet, or even replace the air filters in their home. But they never think to look at the medication they've been taking every morning. That's because the cough caused by Lisinopril can develop weeks, or even months, after starting the medication. By then, most people no longer associate the two. Unlike a chest infection, this cough is usually dry. There's little or no mucus. It often feels like a constant tickle deep in the throat. Some people notice it more at night, while others find themselves coughing during conversations or waking up because of it. Although it can be frustrating, the cough itself usually isn't dangerous. However, it can become annoying enough to interfere with sleep, social activities, and overall quality of life. The good news is that you don't have to simply live with it. If you develop a persistent dry cough after starting Lisinopril, tell your healthcare provider. In many cases, your doctor may decide that another medication, such as Losartan, is a better option for you. Never stop taking Lisinopril on your own, but don't ignore the symptom either. There's another reason this conversation is so important. While the dry cough is generally harmless, there is one rare reaction that requires immediate medical attention. If you ever notice swelling of your lips, tongue, face, or throat, especially if it's accompanied by difficulty breathing or swallowing, don't wait for it to improve. Call emergency services immediately. This condition, known as angioedema, is uncommon, but it can become life-threatening if treatment is delayed. Fortunately, most people taking Lisinopril will never experience it. Still, knowing the warning signs could make all the difference. Remember these two simple rules. A persistent dry cough should be reported to your doctor. Swelling of the face, lips, tongue, or throat is a medical emergency. Understanding the difference can help you respond calmly and appropriately if either situation ever occurs. Now, there's another hidden risk that many seniors don't expect. It isn't found in the prescription bottle. In fact, it may already be sitting on your kitchen table, disguised as a heart-healthy choice. Let's talk about potassium, and why too much of it can become a serious problem for people taking Losartan or Lisinopril. Things #4. The hidden potassium risk. Most seniors never see coming. Now let's talk about something that surprises many of my patients. The next risk isn't usually found in your prescription bottle. It's often sitting in your kitchen. If you're taking Losartan or Lisinopril, one of the most important minerals in your body can slowly build up without causing obvious symptoms at first. That mineral is potassium. Potassium plays an essential role in helping your muscles contract and keeping your heart beating in a steady rhythm. Your body needs it, but only in the right amount. Here's where these medications come in. Both Losartan and Lisinopril can make it harder for your body to remove excess potassium through the kidneys. For many people, this isn't a problem, but when extra potassium is added through certain foods, supplements, or salt substitutes, levels can gradually become too high. The challenge is that high potassium often develops silently. At first, you may notice nothing at all. Later, some people begin to feel unusual muscle weakness, fatigue that seems out of proportion, muscle cramps, or an irregular heartbeat. These symptoms are easy to dismiss as aging, dehydration, or simply having a bad day. But sometimes, they can be signs that your potassium level needs to be checked. One patient of mine, Mrs. Linda, wanted to make healthier choices after being diagnosed with high blood pressure. She replaced regular table salt with a salt substitute because the label said it was better for your heart. What she didn't realize was that the product contained potassium chloride instead of sodium chloride. Since she was already taking Losartan, her potassium slowly climbed over the next few months. She wasn't careless. She was trying to do the right thing. Fortunately, a routine blood test caught the problem before it became serious. That's why I encourage every patient taking Losartan or Lisinopril to do one simple thing. Read the labels. If you see the words potassium chloride, don't assume it's automatically safe just because it's marketed as a healthier alternative. The same advice applies to certain electrolyte drinks, potassium supplements, and some meal replacement products designed for older adults. This doesn't mean you should avoid foods naturally rich in potassium or stop eating healthy foods on your own. It simply means that your medication changes the conversation. Your doctor may occasionally order a blood test to check your kidney function and potassium level. Those lab tests aren't just routine paperwork. They're one of the best ways to make sure your medication is continuing to help you safely. And before adding any new supplement, electrolyte powder, or salt substitute to your daily routine, ask one simple question. Is this safe with the blood pressure medication I'm taking? That one question could prevent a problem that's completely avoidable. Now, there's another everyday habit that can quietly interfere with these medications, and it's something millions of Americans keep in their medicine cabinet. Let's talk about common pain relievers like ibuprofen and naproxen, and why they may not be as harmless as they seem when you're taking blood pressure medication. Things #5. The pain relievers that can quietly work against your blood pressure medication. Now let's look at something that catches many seniors completely off guard. It isn't another prescription medication. It's something you can buy almost anywhere, at the grocery store, the pharmacy, or even a gas station. I'm talking about common pain relievers like ibuprofen and naproxen. Many people take them for arthritis, back pain, sore knees, or headaches without giving it a second thought. After all, if they're sold over the counter, they must be harmless, right? Not necessarily. If you're taking Losartan or Lisinopril, these medications deserve a little more caution. Here's why. Your kidneys rely on a healthy blood supply to filter waste and maintain the right balance of fluids and minerals. Losartan and Lisinopril affect how blood flows through the kidneys in a way that helps protect the heart and lower blood pressure. Ibuprofen and naproxen, however, can reduce blood flow to the kidneys. When these medications are taken together, especially in older adults or anyone who is dehydrated, the kidneys may be placed under extra stress. For some people, that stress remains mild. For others, particularly those with existing kidney disease, diabetes, or heart failure, it can increase the risk of kidney injury. There's another issue many people don't realize. Regular use of NSAIDs like ibuprofen may also make it harder for your blood pressure medication to do its job. In other words, you may be taking your prescription exactly as directed, yet your blood pressure begins creeping higher because another medication is quietly working against it. I've seen patients become frustrated when their blood pressure suddenly becomes difficult to control. They assume the prescription has stopped working. But after reviewing everything they were taking, we discovered they had been using ibuprofen every day for chronic joint pain. Once that issue was addressed, their blood pressure became much easier to manage. This doesn't mean you can never take ibuprofen or naproxen. There are situations where they may still be appropriate. The key is not to use them regularly without first discussing it with your healthcare provider or pharmacist. If you need pain relief on a frequent basis, ask whether there's a safer option for your particular medical history. A simple conversation today may prevent a much bigger problem tomorrow. And speaking of situations that can unexpectedly change how your medication works, let's talk about what happens when you get sick. Because even a simple stomach virus with vomiting or diarrhea can completely change how your blood pressure medication affects your body. Thing #6. What to do when you're sick, because your medication may not behave the same way. Now let's talk about a situation that almost every senior experiences at some point. You catch a stomach virus. You have vomiting, diarrhea, a high fever, or you're simply unable to drink enough fluids for a day or two. Most people think, I'll just keep taking all of my medications like I always do. That seems like the responsible thing to do. But in some cases, it isn't. Here's why. Losartan and Lisinopril are designed to work in a body that has a normal amount of fluid circulating through the bloodstream. When you're losing large amounts of fluid through vomiting, diarrhea, or excessive sweating, that balance changes dramatically. Your blood volume drops. Your blood pressure may already be lower than usual because you're dehydrated. If you then take your regular blood pressure medication, it may lower your pressure even further. That's when some people begin to notice symptoms like dizziness, blurred vision, extreme weakness, or feeling as though they're about to faint when they stand up. For older adults, this can be especially dangerous. A sudden drop in blood pressure isn't just uncomfortable. It can increase the risk of falls, fractures, and head injuries. And there's another concern. When your body becomes dehydrated, your kidneys receive less blood flow. Adding blood pressure medication during that time may place additional stress on kidneys that are already working harder than normal. I remember a patient named Mr. James, a 77-year-old retired firefighter. He developed a stomach bug that lasted nearly 2 days. He couldn't keep food down. He barely drank any water. But he proudly continued taking every medication exactly on schedule because he believed missing even one dose would be dangerous. The next morning, he stood up from his recliner and collapsed. Thankfully, he wasn't seriously injured. His blood pressure had dropped much lower than expected because his body was severely dehydrated. The medication wasn't the problem. The illness had completely changed the environment in which the medication was working. That's an important distinction. It doesn't mean you should automatically stop your medication every time you feel sick. It means you should recognize when an illness involving significant fluid loss may require medical advice. If you're experiencing persistent vomiting, severe diarrhea, or you're unable to keep fluids down for several hours, contact your healthcare provider as soon as possible. Ask whether you should temporarily adjust your medication until you're eating and drinking normally again. Never guess. Never make that decision on your own. A quick phone call can help prevent unnecessary complications and keep you safe while your body recovers. Now, there's another mistake I see almost every day. It has nothing to do with the medication itself. It's how people measure their blood pressure. And surprisingly, that one mistake leads thousands of seniors to believe their medication has stopped working, when it hasn't. Things #7. The biggest blood pressure mistake isn't a high reading. It's reacting to a single number. Now let's talk about one of the most common mistakes I see among older adults. It isn't forgetting to take the medication. It isn't eating too much salt. It's making decisions based on a single blood pressure reading. I can't tell you how many patients have walked into my office saying, "Doctor, my medication has stopped working." When I ask why, they pull out their blood pressure monitor and show me one number. Maybe it was 168/92, or 155/88. One reading, one moment, one conclusion. But here's the truth. Blood pressure is never completely still. It naturally rises and falls throughout the day. It changes when you wake up, after you drink coffee, after climbing the stairs, after an argument. Even worrying about your blood pressure can temporarily raise your blood pressure, a phenomenon many people know as the white coat effect, which can happen at home as well. That's why one high reading doesn't necessarily mean your medication has failed. What matters is the pattern, not the isolated number. I remember a patient named Mrs. Susan, who checked her blood pressure 6 or 7 times a day. Every time she felt stressed, she reached for the monitor. If one reading was higher than expected, she would check it again 5 minutes later, then again, and again. Instead of feeling reassured, she became more anxious with every measurement. When we reviewed her log together, something became clear. The highest numbers almost always appeared immediately after she had been rushing around the house, talking on the phone, or worrying about the previous reading. So we changed her routine. I asked her to measure her blood pressure once in the morning and once in the evening, at approximately the same time each day. Before taking a reading, she sat quietly for 5 minutes, kept both feet flat on the floor, rested her arm at heart level, and avoided talking during the measurement. Within 2 weeks, the numbers told a completely different story. Her blood pressure hadn't become more stable overnight. She had simply started measuring it correctly. Here's a simple routine I recommend to many of my patients. Measure your blood pressure at the same times each day whenever possible. Sit quietly for at least 5 minutes before using the monitor. Keep your back supported and both feet flat on the floor. Avoid caffeine, smoking, or exercise for about 30 minutes beforehand if you can. Record your readings and look for trends over several days, not isolated spikes. Most importantly, never change your medication because of one unexpected reading, unless your healthcare provider tells you to do so. One number is a snapshot. A week's worth of readings is a story. And good medical decisions are based on the story, not a single photograph. Now that we've talked about medication and monitoring, let's look at something many people overlook. Because even the best blood pressure medicine can't do its job effectively if it's working against unhealthy daily habits. Thing #8. Your medication helps control blood pressure, but it can't replace healthy habits. Now let's talk about something that often surprises people. Many seniors believe that once they start taking blood pressure medication, the problem has been solved. It's an understandable assumption. After all, the numbers on the blood pressure monitor improve, and you begin to feel more confident. But here's what I want every patient to understand. These medications control high blood pressure. They don't cure the condition that's causing it. Think of it this way. If your house has a leaking roof, placing a bucket on the floor will catch the water. The bucket is doing an important job, but it hasn't repaired the roof. Blood pressure medication works in a similar way. It helps reduce the pressure inside your arteries, lowering the risk of heart attack, stroke, and kidney damage. But it can't completely undo years of changes that naturally occur as we age. Your arteries may become stiffer over time. Extra body weight can force your heart to work harder. Too much sodium causes your body to retain more fluid, increasing pressure inside your blood vessels. Poor sleep raises stress hormones that make your arteries tighten. Lack of physical activity gradually reduces the flexibility of your cardiovascular system. No medication can fully overcome all of those factors by itself. That's why two people taking the exact same medication and the exact same dose can have very different results. One person stays active, eats a balanced diet, sleeps well, and follows up with their doctor regularly. The other lives with constant stress, rarely exercises, eats large amounts of processed food, and often skips appointments. The prescription hasn't changed. The environment inside the body has. Over the years, I've noticed something remarkable. The patients who achieve the best long-term blood pressure control usually aren't the ones taking the strongest medications. They're the ones who combine medication with healthy daily habits. Even small changes can make a meaningful difference. Taking a short walk most days of the week, reducing highly processed foods, limiting excess salt, getting enough sleep, drinking adequate water unless your doctor has advised otherwise, managing stress in healthy ways. None of these habits replaces your medication, but together, they help your medication work more effectively. That's exactly what we want. Not more medication, better results. And finally, we've reached the most important lesson of today's video. It's the one message I wish every patient heard on the day they received their first prescription. Because understanding this simple truth can completely change the way you manage your health for years to come. Things #9. The one truth every senior should understand about blood pressure medication. We've covered a lot today. We've talked about how these medications work, why certain side effects happen, what warning signs deserve immediate attention, and how everyday habits can influence your blood pressure. But if there's one message I hope you remember after this video, it's this. Amlodipine, Losartan, and Lisinopril don't fix high blood pressure. They help you manage it. That may sound like a small difference, but it's one of the most important concepts in medicine. Many people expect their prescription to solve the entire problem. Then, after a few months, they ask, "Doctor, if my blood pressure is normal now, do I still need the medication?" The answer depends on your individual health, but for many older adults, high blood pressure is a long-term condition that requires ongoing management. The medication is helping keep your blood pressure under control. It isn't necessarily removing the underlying changes that developed over many years. That's why regular follow-up appointments are so important. Your doctor isn't just checking your blood pressure. They're monitoring how your heart, kidneys, and blood vessels are responding over time. They're making sure the medication is still the right choice for your current health, not just the health you had a year ago. And remember, your treatment plan isn't limited to what's inside the pill bottle. The healthiest patients I've cared for over the years all had one thing in common. They didn't simply take their medication. They understood why they were taking it. They asked questions. They reported new symptoms instead of hiding them. They monitored their blood pressure correctly. They stayed active, ate wisely, and worked together with their healthcare team instead of trying to figure everything out alone. Knowledge became part of their treatment. Before we finish, here's a quick checklist you can remember. Take your medication exactly as prescribed. Don't ignore new symptoms, and don't stop your medication without medical advice. If you're taking amlodipine, report persistent ankle swelling that becomes bothersome. If you're taking lisinopril, tell your doctor about a dry cough, and seek emergency care immediately if you ever develop swelling of your lips, tongue, or throat. If you're taking Losartan or Lisinopril, ask whether your potassium and kidney function should be checked regularly. Be cautious with over-the-counter pain relievers like ibuprofen and naproxen, especially if you use them often. If you're sick with significant vomiting, diarrhea, or dehydration, contact your healthcare provider before making changes to your medication routine. Measure your blood pressure the same way, at the same time, and look for trends, not isolated readings. These simple habits can help you get the greatest benefit from your treatment while reducing unnecessary risks. I want to leave you with one final thought. Your medication is an important tool, but you are the most important part of your treatment. The more you understand what's happening inside your body, the more confident you'll feel, the better questions you'll ask, and the better decisions you and your healthcare team can make together. If you found today's video helpful, I'd love to hear from you. Which medication are you currently taking? Amlodipine, Losartan, or Lisinopril? Share your answer in the comments below. Your experience may help another viewer who has been dealing with the same questions in silence. And if you enjoy practical, science-based health advice designed especially for adults over 50, be sure to subscribe to the channel and turn on notifications. I'm Dr. Nathan Ashford. Thank you for spending these few minutes with me. Take care of yourself, stay informed, and I'll see you in the next video.